we've wanted to study the effects of cannabis on driving. And we approached the Office of National Drug Control Policy, or ONDCP, to help fund this important project, considering especially what is going on in our country now and changing rules on cannabis. NHTSA, the National Highway Traffic Safety Administration, had built this incredible technology to study the effects of drugs on driving. And NHTSA and ONDCP worked with NIDA to conduct the very first ever study of an illicit drug in the National Advanced Driving Simulator. This is a very important collaboration to look at the effects of cannabis with and without alcohol on driving, and we hope that this can educate the public on these effects. So one of our first findings is the effect of cannabis on standard deviation of lateral position, or weaving within the lane. And we've shown that cannabis increases that weaving in the lane, and that alcohol also increases that movement within the lane. And when you put them together, which is the most common co-occurrence of drugs in drivers, you see that the additive effect of both of those drugs on driving performance. And that's a public health and safety issue. Also, because we had measurements of the cannabis before and after the drive, all the time after they smoked, we also had the alcohol measurements. We were able to develop a model that would tell us what the concentration of THC, delta-9 tetrahydrocannabinol, that's the main psychoactive ingredient in cannabis, what concentration of THC would equate with certain important levels of alcohol, like 0.08%, which is the legal limit in the United States. And we found that 13.1 micrograms per liter of THC produced the same effects on SDLP as 0.08% alcohol. Another very critical factor, though, is these are the measurements of THC in the blood at the time of driving. And unfortunately, it takes a number of hours, usually somewhere 2 to 4 hours, after a policeman stops someone for impaired driving, or perhaps after an accident, before we get the blood. And THC decreases very rapidly. So the amount during the drive of between 8.2 and 13.1 micrograms per liter, by the time you collect the sample, can be much lower, maybe around 1 or 2 micrograms per liter.